Hey guys, Dr. Rob here, and I wanted to welcome you back to my Health Corner, where today we're going to be talking about 5 special nutrients and foods that are amazing for autoimmune disease and inflammation, which is pretty cool because almost every disease out there, no matter what you're suffering with, has a component of inflammation to it. So put on your lab coats and let's get ready to dive in. But before we do, if along this healing journey you find that you like this information that I cover today, please hit the like button. And if you like me and want to hang out with me more and get more of this greatness or goodness or cool information, please go ahead and also hit the subscribe button and hit that notification bell, bing, to be notified. All right, now the first food or really spice that we're going to be discussing today is saffron. Saffron contains a magical compound in it called quercetin, not quercetin, quercetin. And this particular substance, it calms inflammatory cytokine production. Now, what does that mean? What's a cytokine? And why is it important for people that are dealing with inflammation and dealing with autoimmune disease? Well, a cytokine essentially is a chemical that's released by a cell when the cell feels like it's in danger. So the cell releases a little chemical and says, hey, help me. And it floats into the bloodstream or it floats into the area around it called the extracellular area. And what happens is another cell will be kind of just strolling by and it will see these inflammatory or help me cytokine. And that cell could be a white blood cell. And when it sees that, it goes, oh my God. And it alerts all the other white blood cells and it alerts the whole immune system. And now you get an autoimmune reaction. So from singular cells being in danger or in damage, they alert other cells like white blood cells through cytokines to say, hey, we're in trouble. And then the white blood cells alert the whole immune system. And now you have an autoimmune disease or an inflammatory reaction. The truth is, there's usually something inside the cell, like a toxin or a parasite or a yeast or a fungi or a mold or a heavy metal. There's something in the cell damaging it. So the cell is going, help me, help me. Of course it is. If you were being strangled by someone, you too would be like, help me, help me. The truth is, we need to find out what's in the cell or what's damaging the cell. Because if you remove that, you remove the autoimmune disease. The autoimmune disease goes away, which is one of the reasons why we've got great results in the clinic with autoimmune conditions. Not claiming to treat them, but one of the reasons why we've helped people heal their bodies with this, because we hit and handle the root cause. But regardless, what saffron does is it calms all the cytokines. Kind of good because you don't want too many cytokines floating around having this horrible autoimmune reaction. Then you have pain, you have inflammation, you have skin eruptions, you have a damaged thyroid, you have whatever it is that your immune system is attacking, that's what you have. And what saffron does is it calms that whole response. As a matter of fact, the other 4 foods that we're going to talk about today all kind of do that. They're more specialized for different autoimmune diseases, so we're going to cover this. Okay, number 2 on the list is great for people with any type of gut inflammation or gut autoimmune disease. So if you have atrophic gastritis, if you have ulcerative colitis, if you have Crohn's disease, if you have EOE, any of these type of conditions, or really just gastritis, esophagitis, GERD, inflammatory bowel disease, aloe. Aloe contains a special polysaccharide. Polysaccharide is just a fancy term for carbohydrates. So saccharides are carbohydrates, poly means many, so many little pieces of sugar put together, or saccharides are sugar actually, and poly is many, so many little pieces of sugar together. So we have these polysaccharides. One in particular that's in aloe is called acemannan. And what acemannan does is it calms the autoimmune response in the gut. That's essentially what it does. The way you use aloe, if you have any type of gut inflammation, is you actually get the entire leaf, you slice it down the middle, you peel it back with a spoon, and then you take about a teaspoon up to a tablespoon 3 times per day, either immediately before a meal or 2 hours after meal. And you do that for 4 weeks. You don't want to use aloe really for more than 4 weeks. And you do have to be cautious because if you suffer from diarrhea, in certain cases, aloe can aggravate the condition. But aloe by itself is great for many autoimmune diseases of the gut, as well as inflammatory conditions of the gut, like GERD, esophagitis, gastritis, stomach ulcers, duodenal ulcers, IBS, anything like that, you can look to aloe. Okay, so number 3 on the list is great for French fries. What do I mean? I mean, if you like to eat French fries, like I love French fries. I don't eat them, but I would like to eat them like all the time. If you're like me and you want to eat French fries, but you know they're not good for you, eat yucca fries. Now, if you look at a piece of yucca, it looks like a tree branch or bark. Maybe it looks like that because it's actually really good for your bones and joints. So it's strong and sturdy, right? So it might be a nature clue letting you know, hey, if you have joint problems or bone problems, eat some yucca. One of the other amazing things about yucca is yucca inhibits a compound called nuclear factor kappa B. NF-kappa B. Why is this, or NF-KB, why is this good that inhibits that? Well, I'm going to tell you. NF-KB is strongly important in the initiation of cancer, meaning it's one of the items that brings cancer about or starts the process of cancer and is seen in other places along cancer's journey and development in the body. So it's good to inhibit NF-kappa B to a degree. Yucca does that. But in addition to that, NF-kappa B does a couple other things. One, it increases these inflammatory cytokines like I discussed previously when we were talking about saffron. So NF-kappa B increases those. But it does one other horrible thing that yucca stops it from doing, like a big club smashing kappa B in the head. It stops it from making what are called adhesion, molecular adhesion proteins. And what these are gooey, sticky stuff that gets on the outside surface of a cell and causes one cell to stick to another cell. Why is that bad? You don't want your cells clumped together. Like, look, I like holding hands with my wife and I like holding hands with my kids when they were little, but I don't want to be holding hands all the time. I don't want to be interlocked with people. I don't want to have my 5-year-old on one leg, my 7-year-old on my other leg, my father-in-law on my right arm, my wife on my left arm, someone else's kid on my back, someone else's kid around my neck, maybe a dog at my waist. You know, it's too much. It's not good. The same thing is true with your cells. They need to move, man. Your cells need to move and flow throughout your body. We don't want them sticky. Sticky cells are often bad disease cells. When you look at blockages that occur in the arteries, what's happening? The cells are sticky and they stick to the walls. When cells come to clump together, we get disease. We have increased inflammation. So when you have diseases like psoriasis, lupus, rheumatoid arthritis, especially any type of joint arthritis, psoriatic arthritis, these conditions, the cells often or sometimes are sticky and they clump together and they create these inflammatory, yucky compounds. And then the body starts to actually break them down and erode them. And then you have all this joint damage that you see in rheumatoid. So yucca is great for all those cases. It's also good for the gastrointestinal tract. It contains healthy fibers that feed the beneficial bacteria in your gut so they can grow. It like gives them food, it gives them nourishment, it gives them power, which is what we want. So yucca sounds like a strong word, feels like a darn mini baseball bat or club. Hey, if you ever get into trouble walking out of a supermarket, you get your yucca in your hand and start swinging, I think you'll be okay. Number 4 on the list is capsaicin. This is that hot and spicy compound that you find in things like jalapeno peppers, habanero peppers, Scott bonnet peppers. And what does capsaicin do? Well, it reacts with a very specific type of receptor called TRPV1. This is actually your spicy receptor. It's those receptors that make you go, oh, this is really hot. But those same receptors do something else. It seems like they may cause a cascade of chemical reactions in the body that actually reduce pain and inflammation. This is why red peppers have been used traditionally for years for conditions like pain. So people that have conditions like fibromyalgia, polymyalgia, chronic pain syndrome, these people might benefit from introducing spicy foods. However, we have to make sure there's no GERD, which is gastroesophageal reflux disease, gastritis, heartburn, indigestion, stomach ulcers, duodenal ulcers, or lower bowel ulcerations or bleeding occurring, because in those cases, sometimes capsaicin can make the problem worse. But overall, if you suffer from pain and autoimmune disease related pain, give capsaicin a try. providing you don't have those contraindications. And last but not least, number 5 on the list is the compound quercetin, which is found in onions, apples, and parsley. At least that's where I like to get it from. It's found in other foods as well, like red wine. But I do not suggest drinking red wine if you suffer from pain, inflammation, or autoimmune disease. However, these other foods, especially like parsley and onions and apples, may be good for many different types of autoimmune conditions. What the quercetin does is it, one, calms a cytokine response, like we discussed in the beginning. But the other thing the quercetin does is it calms the whole histamine response. So histamines get increased when people have like sinus congestion or they start to get itchy or hives, right? We see this in a condition called mast cell activation syndrome. Quercetin calms the histamine response, it calms the cytokine reaction, and it basically just chills the body out. So it's great when there's allergies present, when there's itchiness, when there's hives, when there's autoimmune conditions present. Quercetin can be sometimes your best friend. Now, if you suffer from a specific autoimmune condition called Sjogren's syndrome, then quercetin might not be ideal for you. And the reason why is quercetin can be a little drying. And if you're already dried in the condition like Sjogren's, where you're not producing enough saliva, you're not producing enough ocular secretions or throat secretions, everything's kind of dry. And sometimes they need to chew gum just to keep their saliva secretions up so things just don't turn into sandpaper right in their mouth. So in those situations, quercetin may not be optimal. But for many autoimmune conditions, quercetin can be your best friend. So try these 5 foods out, try the spices out, try this different stuff, see how it goes. And if you like this information today, please hit the like button. If you want to hang out with me more, subscribe and notifications bell. And if you want some more information on how to get your body healthy, things that might really empower you, then check out this video right